Yes, before you know it, which is probably a testament to how fast the year's gone in general.
Yep.
But yeah, we are excited. We're back with 5 great guests, kicking off today with a splendid one that we'll introduce and bring in here in a minute. As always, you can find our podcast here on our John Howard Society of PEI YouTube channel or our website. And you can also find more information about the John Howard on our website and social media through Facebook.
Yeah, so thanks for that, Josh. John Howard Society Week kicking off this week. Always one of my favorite weeks of the year. A chance to look at great work being done by John Howards across Canada. This week we have 5 podcast guests who are going to be focused on the 5 pillars of the federal framework to reduce recidivism. So we are looking at health, employment, housing, education, and positive social networks. Right. And our guest today is going to be focused on the health pillar. That's going to be our first discussion of the week.
Yes.
Josh, do you want to introduce our guest?
Yeah. So Rebecca, if you'd like to give yourself kind of a bit of who you are and what you do, and thank you again for agreeing to be on and join us.
Truly my pleasure. Thanks for having me, and happy John Howard Week. So my name is Rebecca Jesseman. I am the Executive Director of Mental Health and Addictions with Health PEI. I've been in this role for 2 years and have been on the island for just over 4 now, and actually bring a bit of a background more focused on substance use policy, but also in criminal justice and some criminal justice and prison-related involvement in Ontario too. So kind of bring that perspective to this conversation. So really happy to be here.
Excellent. Very happy to have you here.
Yeah. Great. Well, I think we know that there's a clear overlap, but I guess we could start there between kind of the conversation about the prevalence of substance use and mental health in the corrections population, and noting that that overlap and kind of some of the pieces that come to mind there. So Rebecca, I don't know if you want to start by kind of talking a bit about what mental health and addictions at Health PEI does, and then kind of how that segues into some of the work going on with criminal justice individuals, but we'll let you kind of take it where you want to go to get us started.
Sure, happy to. So mental health addictions at Health PEI is responsible for all publicly funded mental health and substance use services across the province. So that is, covers the continuum from the open access clinics that you may have heard about in the media, et cetera, where, you can come into any of our programs across the province and have same day or next day access to a qualified counselor. All the way through to things like addictions recovery homes, to day programs, to more intensive emergency services, such as the new mental health and addictions dedicated emergency department at the Queen Elizabeth Hospital, and of course, inpatient care stays at the Hillsborough Hospital, and across the spectrum of substance use as well, including opioid agonist treatment, inpatient withdrawal management, and outpatient counseling. So that's a very broad brush spectrum of the type of work that we do. We also, of course, provide access to psychiatry services, and, really, I would say a quite robust multidisciplinary team. And one thing I would highlight is that we're currently on a bit of a journey in terms of redeveloping the mental health and addiction system over the past 8 years, that will, culminate with the opening of a new hospital in approximately 2 years to replace the Hillsborough.
Yeah, it's very exciting. And I know there's been a lot of time and effort put into that. And from the sounds of it, it seems like it's going to be a great spot for everyone.
We're excited.
Absolutely. So, Rebecca, just kind of sort of moving into kind of discussing of some of that overlap that Josh had mentioned. I'm sure you've seen it in your role and in your past roles as well. I know I see it in my day-to-day job. that, I think it's very rare that you have someone involved in the criminal justice system who doesn't have some current or past issues with mental health and addiction. So I wonder if you can speak a little bit about kind of what you've seen in that regard in your role, and what services that Health PEI has to offer or will have to offer in the future for those involved in the justice system.
Certainly. I agree. I would say, we're looking at virtually everyone, particularly at the provincial level, in the prison systems, bringing, either a current or historical challenges related to mental illness and substance use. And I think that right now, with the toxic drug supply that we're seeing on the street, we're definitely seeing increased levels of complexity as well. Just in terms of the level of dependency, the compound challenge of drug-induced psychosis, and certainly the impacts of increased overdose rates that can really have a lasting cognitive impact that, again, just further compounds the challenges that individuals face.
Mm-hmm. Absolutely.
Definitely.
So,
yeah. And go ahead. Yeah.
Well, I was just going to say, in terms of the services available, certainly we recognize as well that, the clients that are at PCC are also clients that we see in our services, oftentimes in the emergency department, sometimes inpatient withdrawal management, or, in our inpatient acute care stays, as well as in our transitional and community programs. And one of the challenges, I would say, as a system that we have is how to serve the increasing complexity that we're seeing, as I mentioned, with the mental health, the substance use, and in particular, the housing challenges that we see in the population, where we know that regardless of the quality of service that we can provide to individuals, it's very hard to focus on maintaining wellness from mental illness or substance use when you're uncertain of where you're going to sleep that night, or you're in an environment that, really is more conducive to substance use. So, again, it just really, as a system, I think we're working with partners in justice and partners in housing and social development to look at, what does a more coordinated approach look like to meet those complex needs.
Absolutely. And I think you hit the nail on the head there in talking about housing, that stability that housing can bring to people's lives is so important. It's very difficult, if not impossible, to deal with other issues, like you said, like substance abuse or mental health, or really any other issue. If you're just kind of stuck in survival mode, where am I going to sleep? How am I going to get out of the cold on a day like today?
Exactly.
Yeah.
So what services does Health PEI for mental health and addictions have at the Provincial Correctional Center here in PEI?
So in PEI, justice is responsible for healthcare within the prison.
Okay.
So we don't have direct services within the prison itself, but we do certainly partner with the prison to look at how can we support people when they're coming out of prison. So that can be through, making sure that there's information sharing on referral pathways. One thing that, I know the province has made good steps on in recent years is the continuity of access to opioid agonist treatment and the ability to initiate treatment while in the prison. Yes. Certainly we know that, disrupting that kind of support can be really detrimental to somebody's substance use health. So really focusing on what are those care pathways? Are we exchanging information in a timely way so that the nurses within the prison have the information that they need to continue somebody's support, and vice versa, so that when somebody's being released, if they're being connected to our services, that we have the information we need about them to best serve them. And there's kind of a whole separate track too in terms of forensic mental health services. So for individuals who are under assessment or have been deemed unfit either to stand trial or deemed not criminally responsible, those individuals would then move from the responsibility of the justice system to the responsibility of the mental health system.
Okay.
Okay.
Very good.
Interesting.
Yeah, a couple of things you talked in there that I think are, again, very important. I do know, again, sort of in my day-to-day job, that one of the big things on dealing with the substance abuse issues, like you said, is that the jail now has the ability through its own nurses and kind of healthcare providers in the correctional facility to actually start people on, as say, the opiate agonist treatment, whereas before they required some kind of, they were either already had to be on it or had some outside prescription for it. Now it can be prescribed by the jail, which is obviously very helpful when you have a lot of people coming in from the jail who have been, using hard drugs on the street daily, and then all of a sudden they're forced to go cold turkey. That can have a whole host of not just kind of behavioral, but medical and other kind of issues as well. So that's been a very big step in that regard.
Absolutely.
And then one of the other things you mentioned here is about people who are found unfit or not criminally responsible by virtue of mental illness, and then they fall under they then move back under the purview of Health PEI. One kind of thing that I do know there, again, that I think is one area, unfortunately, that our province is a little behind in, is that we don't have a forensic psychiatrist of our own on PEI, unfortunately, to do those assessments on people.
That is correct.
Yeah, so I think that's something I'm sure I know I would love to see it, and I'm sure you would too. If there's any forensic psychiatrists out there listening, PEI is a great place to come and work.
There you go.
I echo that. I've definitely challenged our recruitment team to see what they can do, but I'm also on calls regularly with colleagues across the country. And we certainly know that there is a shortage across the board. So it's really challenging to secure qualified folks, particularly in a context where we know that the demand is continuing to increase much faster than the supply.
Right.
Yeah, and I think that's another thing. I think you're also quite right that the demand for those types of assessments for people to determine if they are unfit to stand trial or criminally responsible seems to have been increasing significantly. So as you say, whereas before maybe it wasn't such a big deal when there weren't so many, we could send them off island or have an off island psychiatrist come and do the assessment. Now the demand is such that it really is becoming an impediment not to have a forensic psychiatrist of our own.
It is, yeah, it's challenging. We still do have pathways to access that expertise. So, I wouldn't want to give the impression that we're not meeting our requirements for due diligence. It's certainly a bit more logistically challenging when we don't have one on the island, but we do have some good relationships with experts off island that we can reach out to and ensure that the assessments are done when they are required.
Absolutely. No, absolutely. You're quite right there. One thing I wondered, I don't know if maybe you're able to speak on this, is we're talking about opioid agonist treatment. I know there's been a real move or a real push recently to get a lot of people on a new treatment called Sublocade, which is for those that don't know, it's I think it's and you can correct me if I'm wrong on this, Rebecca. It's an injectable treatment, and it's one that's sort of longer lasting, so it can be given only once a month, as opposed to Suboxone or methadone, which have to be given daily to the user. What do you have what are your kind of thoughts on that, if you have any, about the efficacy of Sublocade versus some of these other treatment types, and the kind of the push to get everybody or to get more people onto the Sublocade?
I would say, as with any treatment, it's important to look at what is a match for the individual's needs and, for example, their lifestyle. So if it's an impediment for them to be able to go to a clinic on a daily basis for an observed methadone dose, for example, whether that's because they're in employment or in education and their lifestyle, their schedule doesn't allow for it, or if it's somebody who's perhaps street involved and they have a bit more of an erratic schedule and they aren't regularly presenting. And we know that there can be challenges in terms of dosing intolerance, et cetera, if we get into inconsistent doses. Those are two examples for, where the longer acting injectable might be a good option to explore, but it's ultimately should be a discussion between the individual and the treatment provider as to what's going to be best to meet their needs.
For sure.
Yeah,
for sure. Yeah. So I have all sorts of things in this topic that I'd love to talk about. So one thing, Rebecca, that I'm very interested to get your opinion on is, so you've been involved in kind of substance use policy in some previous jobs here. One thing that I feel like just anecdotally I've seen from my kind of practice and things like that is that I feel that addiction treatment needs to be, or that addiction treatment is the most effective when it's voluntary, when the person undergoing it says, I want to get better, and they're the ones driving their own recovery. But there's been a real push lately, especially out of Western Canada, to establish what they're calling like compassionate intervention, which is essentially forced addiction treatment for people who suffer from those issues. And it's not something that I've heard being talked about here on PEI, or really in in most of Eastern Canada. But I'd be very curious what your kind of thoughts are on that trend that we're starting to see across the country.
I would say that the evidence backs you up in terms of the efficacy of voluntary treatment as the primary course of intervention. And I would say what my focus is on making sure that we have the scope and availability of services that can ensure that what we're offering is a good match to what people's needs and preferences are. So, I would focus first on looking at what are the barriers to treatment that people are experiencing if we are not meeting needs, and how can we work to overcome those barriers before we start looking at how to force people in. I'd first like to focus on ensuring we have that continuum of care.
Absolutely. And that's kind of something that I've talked to colleagues across the country about, and we talk about governments and, provincial governments in Western Canada spending money on, establishing these kind of forced treatment regimes where, there aren't sort of enough resources or beds in their particular provinces for the people who want treatment to get it when they want it. And I think that's kind of the other thing I've noticed is that when somebody says, I want to get help, or I need to get help, you have a very short window to get them that help before they potentially change their mind, or they fall back into their, kind of say street involvement or using. And so I personally, my belief is that I think governments would be better off ensuring that the resources are there for the people who want them when they want them, rather than focused on trying to force people into something that they don't want, when, as you say, the evidence would probably suggest that's not a very effective route to go anyway.
Yeah, no, I think that makes a lot of sense. And I think it starts to get into the almost like criminalization of housing conversations that we've had with the previous guest around what if we just force somebody into an institution, or what if we just incarcerate people, and that will then lead to rehabilitation. But we know rehabilitation in incarceration or institutions sometimes looks a lot different.
Absolutely, yeah. So another sorry, Rebecca, again, say just I was just recently at a national conference with some of my colleagues talking about some of these issues. So some of this stuff is kind of top of mind for me. I also kind of curious to know kind of thoughts about feasibility or what we think about, say, to the extent that you can talk about it, on kind of some harm reduction approaches, and particularly in correctional facilities. So I know that there are some federal facilities, and obviously, a correctional facility is supposed to be a facility where there are no drugs or anything else of that nature. But I think we all know the reality is that drugs find their ways into these institutions one way or another. And some facilities actually have like supervised or safe consumption sites within the facilities themselves. I wonder if you've ever had any experience in that, and kind of what your thoughts are on their feasibility or efficacy.
Sure. I don't have any direct experience with it. And I have to admit, I have not been closely following the emerging research. I do know that it's been explored more at the federal level, and I believe there has been evaluation work done. I know that, internationally as well, there are some examples where there are supervised consumption sites within prisons, needle exchanges within prisons. I actually had the opportunity to visit one in Switzerland. Oh, nice. But very, very different cultural context as well. So I think again, going back to the importance of looking at any policy or approach in the social, cultural, and resource context in which it's being implemented is so important, because what might be a situation or what might be a solution in one situation, will not necessarily have the same impact in another or the same feasibility. So, we know that there are a lot of any program, any health program, any harm reduction program needs resource support to operate effectively. And we know that, the prison system, again, as other prison systems across Canada, is facing significant challenges associated with, being over capacity and meeting the staffing challenges to deal with the numbers of folks that are, within the prisons. So I think we have to contextualize any discussion with recognition of what is the situation that we're talking about.
Right. No, very, very true. Very true. And just around that topic of harm reduction, are there any harm reduction programs that are offered by Health PEI, mental health and addiction, in terms of like needle exchange or anything of that nature?
So public health actually offers the community harm reduction. So the things like the needle exchanges, et cetera. So that wouldn't be within my purview, so I can't really speak to the details, but I can say that we do offer some harm reduction supplies at our at some of our community programs and clinics.
Yeah, excellent. Oh, that's very good to know.
And you mentioned kind of the overcrowding piece as part of the issue, and I think something that is interesting to think about is that some of the core of the overcrowding concerns comes from some of the charges that are being laid, particularly around things like possession or things like substance use in public or substance kind of related crimes that are committed. And I know that, certain provinces have more kind of substance use treatment court, diversion programming. We have the domestic violence court here and kind of the restorative justice lens. But I wonder kind of your thoughts there, or anything you have there around this idea of introducing more of a diversion stream or substance use court for individuals that are facing charges because of substance use or directly related to substance use.
Sure, and I'm certainly very supportive of discussions about alternative measures for individuals who are facing charges who may not pose a significant risk to the public, and particularly where the offenses committed might be more associated with their mental illness or with their substance use in particular. I think that as with all things, when we talk about introducing new courts, we also have to look at what is feasible within the resources that we have, and whether and what will be the most effective use of limited resources. So I think there's multiple levels of diversion opportunities, up to and including a full dedicated drug treatment court, for example. So, I would support having a conversation and really looking at what is that full continuum, and where can we best meet people at a place that is most effective and ideally less stigmatizing and less with less of a negative impact on their lives, and more supportive, and also using our social resources in the most effective way, and from a justice and a social services perspective.
Absolutely,
for sure.
I want to circle back to kind of something that we were talking about earlier on in the discussion, Rebecca. We were talking about sort of continuity of care for people, coming from the street into the correctional facility, and then leaving the correctional facility and coming back, back into the street. And particularly, maybe this might be more of an issue for those people who are released into homelessness. And I know that it's an issue that we have ourselves. When clients are in the jail, we can find them, we can work with them. But when people get released and they don't have a place to go and they can kind of fall back into their street involvement, we can lose track of them, or it's easy to kind of lose that continuity with them. What's been your experience in kind of seeing how that continuity of care works for people on the mental health and addiction side, leaving the facility? And what do you think can be done to make that transition a little better for people?
Sure. I think warm handoffs are always really important. So, to the extent that we can, rather than just handing somebody a card, have more of a facilitated relationship building, if there's in-reach contact or something to that extent. And I will admit that these are areas that we're exploring and can do better at, in terms of, identifying how we can provide some resources to do that. But certainly a challenge, as you said, once folks are in the community and are back to that cycle of looking for safe housing for the night, it's really easy to disconnect and often difficult to re-engage. So I think that truly wraparound option, and we're seeing some of that for sure. I want to give great respect to some of the work that's being done at the Community Outreach Center in terms of providing on-site counseling and supports, et cetera. I think that's a great example of how we can better meet people where they're at, and just continuing to look at how do we follow people in community. We do have, I'll recognize, for example, our flexible assertive community treatment teams. And these are teams that were recognized or introduced rather about 2 years ago now, I want to say, possibly a bit more, that provide support to those in community with significant mental illness. And that team, if you're on the client list, will continue to follow individuals who are incarcerated. They will work with individuals who are homeless, and work with kind of the various service providers in the community, like the Park Street Shelter, like the COC, Blooming House, et cetera, and the Summerside Shelter to try to work with the community partners in more of a wraparound way, for example, to connect and find out where they are and when they can connect, and provide reminders of appointments, things like that. So I think that type of collaboration across services who are working with the common population is really essential.
For sure. Yeah. And I think that speaks to that interconnectedness. And I think it's interesting that you identify that the healthcare of individuals that are at PCC falls under justice. And so that then kind of creates this temporary kind of absence from them being under the care of folks from Health PEI. And that then results in, like you said, even more emphasis and importance on that collaboration, because there is this transition back and forth between multiple systems and between care and providers. And I guess curious on that sort of, while the justice system certainly would be in charge of that then and responsible for that, I would imagine that there would be some kind of consultation with yourselves as kind of the mental health and substance use experts in that department. And so sort of curious how that process looks, or in terms of, have you been able to try to lend some expertise to them and their staff and the work that they're doing while people are incarcerated?
I'd say it's a pretty emergent conversation, but we have been having some great conversations with PCC, and I would say they're absolutely open to and welcoming the collaboration, and it's kind of exploring between our services and capacities what that might look like, and where we might be able to build that partnership more effectively to reach into some of the shared clients.
For sure. And I know that this is an issue that's also kind of a very live issue or ongoing issue at the federal level in corrections, is that once people are incarcerated federally, they kind of lose their provincial, access or right to health care, right? And they're covered only by the Federal Department of Justice. So I think there's a move at the federal level, in any event, by some advocacy groups to try and bring prisoner health care back under the Department of Health or the various departments of health. And so, yeah, that may be where things start to move in the future, which ultimately, at least for the continuity of care issue, I'm sure would probably be a move for the better.
Yeah.
Well, it's certainly something that some other provinces have already undertaken. I know Nova Scotia and BC and Newfoundland, for example. So there are some models that we can look at for lessons learned should we ever decide to go down that road.
Oh, excellent. Very good.
That's interesting. I didn't know that.
Yeah, I didn't know that either.
I know we are kind of moving in the direction of time here, based on what we had kind of told you. But Conor, I'm wondering if there's anything we haven't touched on that you were wanting to ask here as we move towards kind of the closing pieces.
Yeah, it's a little bit here. So I think kind of some of the one of the other things, particularly in mental health, but in addiction as well. One of the things that really helps to promote people's recovery in the best way possible is having the best service provider for that person, right? So what's kind of the process, Rebecca, of matching somebody to a service provider, you know, and if somebody, you know, if somebody is not experiencing success, or if there's, you know, a particular, they express particular issues with a certain service provider, you know, is there any kind of mechanism of matching that can go on, or changing people around to other service providers?
Yeah, that's actually one of the great benefits of the open access program that we've introduced, because it's based on a team model where you're not necessarily, it's not specifically a one-to-one relationship with one ongoing counselor. You are working with the team. So that provides the benefit of, you know, finding out who on the team you really connect with, and also providing different perspectives, because different team members will bring different experiences, levels of expertise, and abilities to connect at different levels. And that can provide just a better overall approach to treatment and more comprehensive service to the individual than necessarily just having one targeted person.
Right.
Okay.
Yeah. It gives people a range of options to go between depending on how that person fits.
Mm-hmm.
Excellent.
I guess the only other thing that's sort of a hot topic on PEI from time to time that I wonder about is the overdose prevention site. And it's a little bit fresh on my mind because we're putting together some of the survey results from the annual point in time count. And that is when we kind of listed 10 priorities for people to choose from and rank their top 5. It was one that ranked pretty highly for folks, recognizing that, you know, there's a lot of challenges. I think it stems a lot from homelessness as well, that people don't have a safe place to use, or if they have a safe place to stay, there's a lot of restrictions around their capacity to be able to use in that environment, because they may be in a transitional housing spot or a supportive housing spot or a program-based environment where substance isn't an option, or even some of the shelters. So I guess I'd be curious just to hear, I know there's been kind of discussions on and off, and I'm sure there's committees that you or your team are a part of, but just kind of where that's at, or where you think that might be headed as part of the ongoing options and services for people on PEI.
In all honesty, it's not a topic that I'm briefed on, so I'm not able to provide you with an update on where things are at right now. It's really a department lead as opposed to Health PEI lead.
Okay, fair enough.
Yeah, fair enough.
So we've kind of given ourselves a chance to exhaust any of the questions we had. I wonder if there's anything else you would like to take some time and share with folks about Health PEI or services, or how to connect, or some of the up and coming things, or maybe the priorities that our Health PEI is working on, or anything you wanted to add before we move towards wrapping up.
No, I'll thank you for your time and for the discussion. You know, the points that I always like to end on, for one thing, we know that a major barrier to accessing care, particularly for folks who are more likely to be criminal justice involved, is the stigma associated with mental illness and with substance use. So really just wanting to recognize the impact that the stigma has on the people who are experiencing problems, and the role that can play in being a barrier to care, and just really reiterating the message that, you know, we need to see people as people and not as the mental health or substance use challenges that they bring. Right. And just really looking at how we can identify and address those barriers. And also it can be such a barrier to the person too, in terms of the internalized stigma and not feeling that they are worthy of reaching out for help. And there's a quote that a colleague of mine posted that I love and have, up on my computer, and it says, "You belong here and we will never think less of you for your struggles." Mm. And I think that if we could all adopt that as, kind of a guiding principle when we're working with, folks who are having challenges, that would just really help us to reduce some of those barriers. And just that, anybody who is struggling with or questioning whether or not they need support for their mental health or their substance use health, or even a family member or colleague, don't hesitate to reach out. Again, we have open access clinics that provide same day or next day access to trained counselors across the island. And there's also the mental health and addictions access line that is available 24/7, and that can also connect you to the mobile mental health unit. So there's numerous ways to reach out for services should anybody need them.
Yeah. No, that's great. And I think that's a lovely way to kind of end off with the quote and with this sentiment of, the human element and the value that people have in some of these situations that they're struggling with. So thank you for joining us. We appreciate your time. Thank you to everybody for listening. We will be back shortly, actually, with another podcast to talk more about these 5 pillars and some of the other interesting pieces. And interconnectedness is kind of the word that stood out from today that I think falls between all the different pillars. So we'll certainly be exploring that more.
Absolutely. None of these pillars are silos. They all interconnect and work together, and one is not going to be effective without the others as well. So every piece is important. And again, and I just want to echo Rebecca. I think that that's a great way to end off there, to always keep the person first and realize that, people are more than the worst thing that's happened to them or the worst thing that they've done in their life.
Definitely. For sure. Well, thank you everybody for tuning in. We will be back again with another podcast soon. And Rebecca, thank you so much for taking some time and joining us.
Thank you.